Thank you. So, in case we haven't met, I'm Mrs. Gentine, your experiential learning coordinator, and my role here in Mason Schools is to connect you with experiences to help you personalize your career journey. So, welcome to all of our Mason Middle School and Mason High School students joining us today. Just a few basics. You all did a great job of muting your mics when you came in. Up in the top right corner, you will see what looks like a little text box, a little speech bubble, and that is where you can chat or text in your questions. So anytime you think of a question that you would like for Dr. Alten to answer, then you can go ahead and text that question in. However, you might want to wait until near the end of when she speaks, because she might answer it as she's going along. So we'll be sure to take your questions at the end and try to cover everything. She has a lot of your questions already that you've submitted during your registration. So thank you so much. I know a lot of you are here because you're considering a career in medicine. And so today we're thrilled to have Dr. Beverly Alten join us. Dr. Alten specializes in obstetrics and gynecology, and we are thrilled to have you with us, Dr. Alten.
Thanks. I'm glad to be here. I have 4 kids in the Mason School District, one in each of the schools actually, except for early childhood. So I'm excited to share. You want me to go ahead and start?
Please. Yes.
All right. So I actually decided I wanted to be a doctor when I was quite young. Decided that helping people and that career was my path. I didn't actually decide to be an obstetrician, an OBGYN, until I was in medical school and deciding what to do. So I thought I would start with how I got to where it is. This was always my goal, so I started out even in middle school. I enjoyed the science classes. I enjoyed math. I went to college at the University of Missouri, Columbia. I actually grew up in a small town in Missouri. And so even in high school, I took advanced classes. I was in a really small school. My graduating class was 200 people. So nowhere near the experiences that you guys get being in such a large district. But I still graduated at the top of my high school class and went to school at the University of Missouri, Columbia, which is a very large school. It would be Missouri's Ohio State. I decided to do a biology major with a chemistry minor, and I graduated from the honors college too. I went in a little different way into medical school. University of Missouri was trying to keep some of its small town students in the state, hoping that they would practice in their small towns. Well, it didn't work out so well for me, but I got into medical school coming out of high school, assuming that I graduated with a GPA and a degree. So I actually didn't have to do a lot of the things that a lot of other medical students have to do to get into medical school. Of course, this was also many years ago, and I don't know if they have those kind of programs here in Ohio, so you guys will have to investigate that kind of thing. But I know, coming into med school, it's important to have experiences. I have actually in my practice now, I have occasionally a high school student want to shadow for a day, come and experience what it's like in the day of a life of an obstetrician. I know getting into med school, they look at volunteer work and what you're doing with your spare time, your extracurricular activities, your athletics, your leadership skills, all those kind of good things. And you obviously, if you've looked into it much, you also know you have to take an MCAT, which is an equivalent to an ACT gets into college and MCAT gets into medical school. And the interview. And so after your 4-year college degree, then you have 4 years of medical school. During the first 2 years of medical school, it's all science training. It's all science-based. You're learning about body systems and disease processes and all those things of all the systems and everything about the human body. Once you get into your 3rd and 4th years, you go through a series of core rotations, which for us was family medicine, internal medicine, obstetrics, gynecology, psychiatry, neurology, surgery, And am I going to come up with the last one? Maybe not. Anyway, you go through your cores and you learn generalized things about that. And then you have several electives you can take to help you decide what you want to do coming out of medical school. So in my, pediatrics is the last one. In my medical school rotations, I actually came in, thought I wanted to be a pediatrician, and then did my pediatric rotation and didn't enjoy it so much. So after peds, went almost directly into OBGYN and absolutely loved it. And so did a couple of electives in that, along with some other things that I thought would be useful in my life. All my family asked me about their skin questions and their heart attack questions. Not very many of them asked me about what I actually do. So I got some extra knowledge that way. And then you get into residency. Length of residency is dependent on what career path you choose. My sister's a vascular surgeon and a critical care medicine doctor. She did, I think, 10 years of residency total to be double boarded to do what she does. OBGYN, general OBGYN is 4 years. They are a hard 4 years. We worked really hard. We took a lot of call, but it's where you gather all your knowledge to go out in the real world and to practice. Initially coming out of residency, I worked in Houston. I've worked in Birmingham, Alabama. I've worked in St. Louis, Missouri, and now I am lucky enough here to be in Mason. So it's a long journey from high school, college, med school, residency is 16 years. So I always tell people I was out of high school, in school, as long as I was in high school and grade school, in school, 12 years before, 12 years after. But I love what I do. I love taking care of patients and helping women. I do, as far as my job goes, I am an obstetrician and gynecologist. So I take care of pregnant women and deliver babies. But I also take care of all the other female issues that women have. I do hysterectomies and I do other surgeries. It's probably one of the reasons I like what I do so much is because there's a mixture of what I do every day. Some of my days are spent simply in the office seeing patients, OB patients who come in, patients who are having problems with their periods or problems with, other female issues. And then other days I am in the operating room and doing surgery and getting that experience too. And then other days I'm on call and I'm delivering babies and spending time on labor and delivery, managing labor. So I like the different things I get to do every day. I don't have to do the same things every day, which I really enjoy for that variety. Let's see. I should probably. Have we gotten any starts of questions yet?
I see the first one.
I see the first one.
License? Can you see that?
I can. So that's a great question. So there is not. You do get a license in each state that you practice in. You're allowed to hold licenses in multiple states. So just for example, my husband is a doctor at Children's, but because they take care of a lot of people from Indiana and Kentucky also, he has a Kentucky license, an Indiana license, and an Ohio license. So he can take care of those patients who come in from different states. I have currently still my Missouri license because that's where my family is. So I have a Missouri and Ohio license, and I just let my other licenses expire. It's different states have different requirements for getting your license. You have to be a year out of medical school, so you have to have a year of experience. But that you're licensed to be a doctor. You're not licensed to be an OBGYN. I can go into that real quick. So each specialty that you have, whether internal medicine or general surgery or pediatrics or whatever, has their own governing board. And so you actually go through a testing process after you get out of residency to be board certified. So it's a really important thing because it means that you've passed the testing and you continue to do testing. I do testing every single year to maintain my board certification. Your medical license is a one-time thing, and unless there's a complaint or a problem, I don't have to reapply for my Ohio license. I have to show that I'm doing some continuing learning, but I don't have to do much else as far as the state license go. To be board certified, that means for me, it's the American Board of Obstetrics and Gynecology. I have to fulfill their requirements, which include articles and testing, and once every 7 years you take another test, and they help you obviously maintain your skills and make sure that you're practicing up to all the standards of care, because as you guys can imagine, medicine is a whole lot different than it was when I graduated from residency a long time ago. So that's how that works. The second one, I didn't have to take the MCATs because I had an exemption because of the University of Missouri accepted me. So I didn't have to take the MCATs. USMLEs are the question is the USMLE step 1 really that hard? USMLE is the testing that you take through medical school to show that you're learning. It's a national test. Every medical student takes it. I think step 1s are done at the end of 2nd year of medical school. Once again, you know, I still took it on paper. I sat in a room with all my classmates and took a test, which you know now it's on a computer. I did well on the USMLEs. I went to a great medical school that was trying a new way of learning called problem-based learning, where we actually experienced things in groups and investigated in groups and taught each other. So it was really a cool learning experience, in addition to the hours and hours of lectures that you sit in on. So I did well on the USMLEs. I obviously studied because I don't think anybody gets through med school without studying. But I didn't. I did well. Step 2s are taking somewhere at the end of 3rd year, maybe, after you've done all your core curriculum, because it covers all the specialties that you do in the core. Like I told you before, obstetrics, gynecology, peds, internal medicine, family medicine, general surgery, and neurology psych. So that's what step 2s are, more clinical. Step 1s are more basic science. And then you take step 3s after you finish residency, after you've been out for a little while. And that's part of your state license also. Do you have to renew your license after a certain period of time? Since we're on the license thing, every year I have to turn in and apply for, actually in the state of Ohio, it's every 2 years. Turn in and apply that I'm still practicing, that I have fulfilled my CME requirements, which is continuing medical education, articles you read. You can go to conferences and get credit, listen to lectures and conferences to get your CMEs. You have to sign that you've done those things and pay the fee, of course, just like any other license in the state. But that's how renewal of the license goes. I'm going to skip the skills one because we're gonna go back to that one in just a second. The question from Kennedy says, what is residency? So residency is a period of time that a medical student basically specializes in whichever specialty he or she wants to go to. So let's say if you think you want to be a cardiologist, you're going to do a 3-year internal medicine residency and then do a fellowship or a second training program to specialize even more in cardiology. So those internal medicine doctors don't deliver babies. They don't do OBGYN stuff. They don't take care of pediatricians. They really focus in on what they're going to be taking care of once they get out and start practicing. Same thing, I did, I think, 1 month of urgent care as an OBGYN in residency, but that's the only internal medicine experience I got. I spent time with the oncologists who take care of GYN cancers. I spent time with the high-risk OB doctors. I spent time in the NICU with the babies that were born early so I could learn what happened after I delivered them. And I spent a lot of time on labor and delivery just taking care of patients. So residency is your training. Unlike med school, which is truly school, and you have tuition to pay, you are subsidized a small salary in residency. So you do have that, but it's it's a living wage. It's just so you can make sure you can pay your bills and do things from that while you're still training. But it's all training. Residency is a training years. Like I told you, OBGYN is 4 years of residency. Internal medicine is 3 years. Pediatrics is 3 years. Surgery is 5 years. And so depending on what residency you choose, which, final career path you're going, that's when it's determined how long. I think emergency medicine is 4 years. So it just depends on what specialty you're going into as to which residency you choose. And there's a big application process for that too. You interview, you make a list. It's called the match. But you make a list of where you want to go, and the residencies make a list of who they want, and then they decide how to divide up people to go into different residencies. So, even as you go through residency, we took a yearly test to see how we were doing with learning. We had learning time every Thursday morning. We were required to be in lectures. But the majority of residency is hands-on experience. How many years overall does it take to become a doctor? That kind of goes along the same lines. I think that, like I just talked about, it depends on what specialty you go to. College is college, whether you take 4 or 5 or 6 years to do it, you get a college degree. I want to touch on that too. So I was actually listening to something the other day where medical schools are leaning more towards allowing people with liberal arts degrees, music degrees, literature degrees, English degrees into medical school. Whereas when I was applying, basically, if you didn't have a biology, chemistry, or biochemistry degree, you weren't going to get into medical school. So I thought that was really exciting that people could explore different things in undergrad and still have the opportunity to go into medicine. I do find that a lot of what I do every day has to do with relating to people and talking to people. I saw a question that said, "What skills have I gained?" The actual skills are easy. You learn how to do surgery, and yeah, it's a learning curve, but you learn how to do it. It's a true skill. I think one of the things that I have learned the most is how to relate to people and how to help people through happy times, because I get a lot of happy times, but I also get a lot of sad times. And so help people deal with the sadness, getting lined up to help their families get through it. I think that's one of my favorite parts of OBGYN is I take care of groups of women. I take care of sisters, and I take care of moms and grandmas, and I then deliver babies, and maybe one day I'll deliver a baby of someone who I've delivered. So it's that continuity of care. It's getting to be a part of those people's lives and to enjoy some happy times with them, and hopefully help them through some hard times at some point, and try to have an impact and do that. Those personal relations are probably the skill that I'm most proud of, and probably the part I enjoy the most. Work-life balance. Medical school is pretty straightforward because you have set times. I actually had a he was 2 years old he was 1 year old when I started medical school. So my oldest son helped me through. He made my priorities pretty straight with what I knew I had to do. I spent a lot of time studying, and I'll tell you this, and I probably shouldn't, but I didn't study in high school. I studied a little bit in college, and I studied a lot in medical school. It is significantly more information given in shorter amounts of time with less multiple choice questions. Medical school is probably the easiest time in the work-life balance because you have set hours just like you do in school now. You know that you're going to have a couple hours of homework to do, but then you know how it's going to go. Residency was a little bit harder because there's been revisions since I went through. There were weeks in my residency where I would work 120 or 130 hours a week. That's not allowed anymore. Residents are limited to 80-hour work weeks, but even 80 hours, if you think that a normal work week is 40 hours, 80 hours is still a lot of time to be at work. And so that's a very difficult time in a lot of physicians' lives, just because it's hard to work that hard and then still be a wife or a mom or whatever else you have to do, or even just to have time to spend with your friends, even if you're still single or dating. It's a pretty difficult time. But once you get out and you can kind of choose, there's a work-life balance in general question too. You know, I chose practices where I was going to have the work-life balance I want. My kids are obviously extremely important to me. I have missed very few soccer games, volleyball games, baseball games, band concerts, award ceremonies. I've missed very few of them because the jobs I chose let me make that a priority. So, you know, in OB/GYN, there's all kinds of different paths, even once you finish residency. There's now people who work only on labor and delivery and stay in labor and deliveries, and they work 12-hour shifts. They work shifts. So they work 12 hours a day for 5 days, and then they get 5 days off, and then they work 12 hours a day for another 5 days, more like what you would think would be an ER doctor's shift. OB/GYNs can do that now. I've always chosen to be in private practice because I like I told you earlier, the continuity of care, continuing to take care of patients through the course of their lives as they go through happy, sad, exciting, you know, marriages, all kinds of fun things, babies, all kinds of good things. So that's where I get a lot of my enjoyment. So that's what I have chosen to do. I've just made sure that the jobs that I've chosen give me some flexibility with my schedule. So like right now, here I am. I'm at home today because it's Friday. I work 4 days a week. And so I have the ability to plan things on days like this, where I can do other things besides work all the time. I also, you know, you guys obviously had school canceled, but I had taken time off for an award ceremony, and I had taken time off I've gone to field trips. So it's just what job you choose and what your expectations are. And I just made my family my number one priority, although I love my job. I absolutely love what I do. Let's see. Stress and workload on a daily basis. I talked a little bit about that because mine changes day to day. You know, there was one week where I gave bad news, really bad news, to 4 people in the course of 3 days. That was a really tough week. But next week I may deliver 3 babies, 3 happy, healthy babies, and have a great week. So mine varies a lot from day to day. I'm pretty good at being able to take a deep breath when I get home and forget about most of my day and be fully there for my family. And with the kids being as active as they are too, and doing all those sports things, I get to kind of lose myself in being a mom. So I mean, I know there's stress, but there's stress in every job. So I don't think mine is that much different than anybody else's. Is it expensive? So yes. I actually, almost everybody who goes to med school has student loans. I had a lot of student loans, but I went to a public medical school, so it was cheaper. Like the Ohio State was a public medical school versus, I don't know what you guys have here, probably like Xavier, right? Is a private school, a private college that has more expense. So I made it a priority when I got out to pay off all our student loans. So we had ours paid off in the first 5 to 6 years of being out, but I made it a priority. It is expensive, but there are ways you can definitely get help to do that. I don't think that anybody who makes it in med school doesn't go because they can't pay for it. So you have to, you know, like I said, I don't like debt. That's the way I was raised. So I paid ours off really quickly. Other people take longer, but it's a celebration when you get that paid off and you can be free of that med school debt. most people, I think it takes closer to 10 to 15 years. I was just kind of psycho about it. I just wanted it done. How is medical school a different experience from getting just any degree? Well, obviously, you know, in college, as a biology degree, I studied fish. I took a class in evolution. I took some philosophy classes. I took some all kinds of exciting things that way. In medical school, you're really doing all human body stuff all the time. You don't really have those extra classes. We were taught, obviously, things like physical exams, so we could examine patients. We were taught how to relate to people when you're having a hard discussion with them. So we were taught some people skills, but the majority of what we did was science, science, science. So that's why you can't use your medical school degree for anything else but being a doctor. It's not like you get a biology degree and then, oh, you decide you want to go into business. It doesn't quite work the same with a medical school, with a medical degree. You're pretty much stuck on your path at that point. I say that, but I had some friends in residency that didn't want to be OBGYNs anymore, decided it wasn't their thing, and they switched and did a different residency. And are now, I think, she's a physical medicine doctor and enjoying life. So, you know, it's pretty much down that once you hit medical school, you're pretty much destined to be some kind of physician. Now, saying that, there are physicians that also work for insurance companies and work telemedicine and do other things like that too. So you're not destined to be that classic doctor with, your white coat, which I don't ever wear, by the way. And the pack with their stethoscope, and you head into the office every day and take care of patients. There's lots of different paths you can do to enjoy the parts of it that you enjoy. Let's see. Do you have to do the cadaver labs in med school? Yes, we were not given a choice. I know there's been some talk now about doing computer-aided cadaver dissections. I love medicine and I love the human body, and I'm amazed by all the amazing things that it can do. So to actually be able to see and explore how that works in a cadaver was actually, once you get over the initial shock, it was very, very interesting. It was pretty cool, and I feel pretty privileged to have been able to do a cadaver. I actually did a second cadaver in 4th year of medical school for GYN too. So we dissected 2 cadavers. So I really hope that you guys get, if anybody decides to go to med school, you guys get that opportunity, because it is very exciting. It's very exciting. That's the second question there. How often do surgery students get to work with cadavers? So I don't know, obviously, about a surgery residency because I didn't do one. As far as residency goes for OBGYN, once we got into residency, we didn't have access to cadaver anymore. But we didn't need it because, I think on my 3rd day of residency, I was first assist on a C-section. So I was being taught on a live patient. I wasn't being taught, I didn't need a cadaver to do that anymore. I had an upper level resident and an attending physician there with me, making sure that that the patient obviously was safe and taken care of. But once you're in residency, you're taking care of patients, so you don't do any more cadavers. We did do, I do a lot of laparoscopic surgery too, camera surgery. And so they set up, basically camera laparoscopic labs where kind of like video games, where we would use the instruments and we would be picking up bolts and screws and things like that to learn how to use the instruments before we would be in on a case with a live patient. But those were all done simultaneously. So we would have, during the didactic time, that learning time, you're going to skills lab today and you're going with your attending physician to do the surgery. So it all kind of happened together in residency. Were you ever scared of performing surgery in the blood? Um, there were definitely some times in medical school where I said, wow, I don't ever want to do that again. Um, uh, you find what's most interesting to you and go there. I definitely almost passed out a couple times, and you just take a deep breath and you keep going because you're expected to do that, and you make it through. But I'm not obviously scared of that anymore. There's just like anybody else, there's parts of the job that aren't my favorite, but that's part of it. One of the big things that someone told me one time when I was trying to decide what I wanted to do that I think is really important, and they said, make sure you can do the boring stuff and not be bored, because realistically, although there's a lot of really cool stuff in my job, a lot of fun things to do, there's a whole lot of just everyday, boring, regular old stuff. Huh? I'm talking, babe. Hold on. And so I can do that boring stuff and come home and still feel satisfied, which is great. So that's actually why I decided to do OBGYN, because I like the boring stuff. I like the everyday stuff. But I think that goes for any career you decide. You need to, there's always that fun and excitement, but you only get fun and excitement every once in a while. You got to like what you're doing every single day to be happy at your job. And yeah, I enjoy working with my hands. And so surgery obviously is a pretty intense skill, but you have to have some manual dexterity and those kind of things too, that you learn along the way. For people who want to enter the healthcare field, what are your words of advice? I think the most important thing is just make sure that you're in it to help people, because that's really what you're doing. All the skills can be learned. I could have decided to do medicine, or I could have decided to do surgery, or I could have done anything. But realistically, when it comes down to it, I like science. I love the human body. I think it's amazing. I really want to be involved with people's lives. And I spend a lot of time, obviously, in face-to-face conversations with people that I don't know. And they're asking, I don't want him. Take him. Oh. They're asking serious questions, and I'm trying to figure out a way to help them. To help them get through it. And so if you're in it for other reasons, then you're going to be disappointed, because once again, it's the everyday stuff that you do that makes it whether or not you enjoy your job. And it would be really hard to work as hard as you have to work to become a doctor, and work as hard every day to be a doctor, and not enjoy what you're doing. So that's my words of advice. Make sure you're in it for that. Do I ever think being a PA or other professional healthcare? I actually did not. You have to understand too that I did this a long time ago, and PAs weren't really around. Nurse practitioners, there were a few of them around, but that wasn't really the thing. Either you were a nurse or you were a doctor. I had watched my grandma actually go through nursing school and found it amazing. And that was my first exposure to healthcare in general. And she was a strong pusher of me to go to medical school. So she told me that I needed to do that. I needed to do that. I was smart enough to do that and good enough to do that, and that's what I should do. So I never really thought of other things. With the new need in healthcare now, I think there is definitely a good place for NPs and PAs. I think we have to remember, as even if you guys don't go into healthcare, that the training is very different between medical school and PA school, even nurse practitioner school. Nurse practitioners do 4 years of college and 4 years of NP, and they're out in the real world practicing medicine, whereas physicians do 4 years of college, 4 years of medical school, and then an additional 3 to 7 years of residency training in their specialty. So I just want to, I think everybody has a place in the healthcare system, but the amount of learning and the amount of hours spent training are very different. And so we just, as a society, need to realize that you probably don't, you want it when things are complicated, you want someone who has the most training and experience to help you through those things. And I think that goes for everything in life. Is medical school more memorization or hard work? It's a whole lot of memorization, I won't lie. I did like the way we trained, because we trained in a problem-based situation where we learned about, let's say, when I can remember the first one was sickle cell anemia. And so we learned about the blood system, the circulatory system, in conjunction with learning about a disease. So it was a little easier than just rote memorization, where you're just repeating back things. But there's still a whole lot of memorization and understanding and studying. You're just making sure that you know how things work. It's important. You can't fix something until you know how it's supposed to be. You have to know what part's wrong. And so I think that's what medical school does, is it teaches that foundation of, here's the right part. Here's the way it's supposed to work. And then it tries to teach you, okay, here's the things that are broken. And so some of that's not memorization. Some of that is understanding. And I think a good medical school does both of that. It's just some memorization because you have to, and a whole lot of putting it in a context. There's a whole lot I encounter on a daily basis that is in no textbook. Patients having a problem that I've never heard of before. And so I go back to that basic science. Okay, well, this is how it's supposed to be, and this is where it's going wrong. How can we change that and alter that? And so that's kind of, people talk about the art of medicine. That's kind of where they're coming from, because not everything. A lot of stuff is easy and in the books and easy to take care of. And then a lot of stuff you have to actually think about it and try to make a plan, thinking about how things work rather than just what the book says. Would you say we have to be people-oriented into the medical field? I mean, there are definitely areas like radiology. They have very little people contact. And we rely on them. I rely on ultrasounds and CAT scans and all those things, mammograms. I rely on all those things to help me. And I need a radiologist to tell me what those diagnostic studies do, because I'm not trained to interpret them. So, pathology is the same way. I send, something from surgery that is abnormal, and I want the pathologist to tell me what it is. Those career options are definitely not as people-oriented as obviously as OBGYN is, and internal medicine and those things. So I don't think you have to be people-oriented, but even saying that, although maybe the radiologist doesn't interact as much with patients, he interacts with me a lot. He interacts with other physicians. He interacts with nursing care and x-ray techs and all those kind of things. So, I mean, I think it's very different than, say, you're writing a computer program for something. I think it's different than that, but I think that you still, you don't have to love to be around people. I'm actually very introverted. I would rather sit at home and play games with the kids and do that than go out and hang out with a big group of people. But I think I have decent people skills on that one-on-one situation. So, people skills has a lot of things that are involved with it. And you have to, you're going to find those things that you're the strongest at, and hopefully you can use that to, help people. What are the ups and downs of being a doctor and not a nurse? So I'm going to tell you why I think a doctor is better, because obviously that's what I chose. I think that, and first of all, there's a lot more schooling that goes into being a doctor versus a nurse. Nurses definitely work shift work. They come in and then they go home and they're done. I'm a kind of person who always wants to know why. So in college, I actually worked in the lab in a hospital, and I drew blood. It was a good job. It worked around my college schedule, and it looked good on my resume too, my applications, because it was in the healthcare field. And the whole time I was doing it, I would sit by the lab techs, the people who had a medical degree or had a degree in laboratory medicine, and I would ask questions. Well, what does that mean? Well, why are they looking at that? Well, what's going on? And so I think that is what really told me that I needed to be the doctor. I needed to be the one who ultimately understood what was going on with the patient. I value my nurses tremendously and definitely couldn't do my job with all of that. But ultimately, I'm responsible for the patient, and I'm responsible for her care, and I'm responsible for keeping her and her baby and everybody else safe. And I wanted to be the one responsible. I wanted to be the one who understood everything and knew how to make those final decisions. I also get the opportunity to teach people and help people and do that from my perspective too. So, if a nurse has, we have a conversation about why this is happening, and I have the background knowledge to explain kind of what's going on in the background, why I'm deciding what I'm deciding, and so that we can work as a team to keep patients healthy. This is a good question. Do you have to complete both a fellowship and a residency? So your residency is your initial training out of medical school. So you don't have to complete a residency, but realistically in this day and age, you have to complete a residency. You have to complete a residency to be board certified. So you can't be boarded unless you have done a residency. A fellowship is then a second level of training. So let's say I wanted to do high-risk OB. So I would do my 4 years of regular OBGYN residency, and then I would do 3 more years of high-risk OB, high-risk to take care of high-risk moms who are pregnant. Same thing, I think I alluded to it earlier, you do 3 years of internal medicine, but you don't want to do just general internal medicine, you want to be a cardiologist. So then you do another, I think cardiology is 2 years, I don't know for sure, another 2 years. It's not working? I can't help you, I'm sorry. Go back on and do it again, or do it on my phone. Sorry. So residency is just additional training. So like my sister did, she's a vascular surgeon. So she did 5 years of general surgery, where she did surgery on all parts of the body. And then she did another 4 years of vascular surgery, where she specialized in just those very specialized operations that general surgeons don't. So it's just that one more step of training. Fellowship is just called that next step. So you can't do a fellowship unless you've already done a residency. Hopefully that answered that question. Pros and cons of being emotional and working in healthcare. I think the pros of it is that people want to relate to you. They want to see that you care about them. And so if you're an emotional person, then those emotions are going to come out. And I think people appreciate that. Most people appreciate that. The cons obviously is you can't take all those emotions home with you all the time. You have to draw that line when you walk in the door, because if you used all your emotions on your patients, then how are you going to take care of your kids and your husband and all those other things? So you have to find that fine line between caring and truly being involved in the moment, and then being able to walk away and say, okay, now I have to take care of the next patient or go home and take care of my family. So that's a learned skill. That's something that comes with time and experience, and it's definitely it's a hard part of the job. It's a hard part of the job. If I wasn't an OB, what else would I consider training in? I would probably have to do something. I don't even know. I've thought about that before, but it's a I went back to that. You have to do something that you don't get bored with every day, right? And pretty much most of the other things I've experienced, by the time the end of the day comes, I'm bored and I don't want to do it anymore. So, I mean, I don't know what I would do. I don't know. I've never really thought about it. I love what I do so much. I love my job so much. Probably if I had to do something besides private practice, I would go to labor and delivery. I love delivering babies. It's one of the coolest things in the entire world. And watching mommies and daddies go through that is super awesome. And so if I wasn't going to do private practice like I'm doing now, I'd probably go work somewhere like Good Sam and be on the labor and delivery floor and take care of patients that way. How do you join a private practice? So you interview, just like you interview for any other job. When my husband got a job at Cincinnati Children's, he is a pediatric ICU doctor. So when he got a job at Children's, I basically looked at job openings and found some that I thought would fit with what I wanted and interviewed, and same way you get a job any other way. One of my other jobs when I worked in St. Louis, she was actually somebody I knew. And so through connections, we decided to start practicing together, and I joined her group that way. But most of the time it's through interviews with the people that you're going to practice with, because in private practice, anyway, in my practice right now, we share call. So if I have a patient that I've been taking care of, if she comes in the middle of the night and it's not my call night, my partner will take care of her. So it's important to have partners that take care of patients the same way and are, following guidelines and doing those kind of things, because they're going to take care of your patients when you're not there. That goes back to that work-life balance that someone else asked about earlier. That's one of the important things. I did not want to be on call 24 hours a day, 7 days a week. I want to be able to sit at a soccer game and enjoy myself. And so that's one of the things that was really important and something I looked for when I interviewed for jobs. What is my real life going to look like? Am I going to be able to, eat dinner with the kids, pick somebody up? Am I going to have times when I'm off and be able to do some of the things I enjoy? And so that's one of the reasons I chose. That's one of the reasons I chose this job, was for all that flexibility that I have. I think that answers most of them. Debbie, do you have something you want me to talk about?
I think sorry, I feedback here.
So there's a couple more. I could do it. I could do, these are good questions. Does medical school introduce you to many different specialties, or do you have to guess what you want as a career? I think I touched on that just a touch. You're exposed to the 6 basic ones. Every medical student is. Peds, OB. I did 2 months of Peds, 2 months of OB, 2 months of internal medicine, 2 months of psych, 2 months of surgery, and 2 months of family medicine. So from that perspective, then you're experiencing that. You're watching doctors work every day. You're seeing patients, even though you're extremely supervised. So you get that. And then depending on what you think you want to do, you can make your choices in your 4th year of more a month of doing, just like I did an ER rotation because I thought maybe I would like the ER. So I did a month of ER my 4th year. I did a month of dermatology my 4th year. I did a month of high risk OB because I wanted that on my resume because I thought I wanted to do OB. And so you have to, and then even in residency, if you think you're going to want to specialize even more, you'll have chances to do rotations on different services so that you can know what that's like and how interested you are with that. And so So yes, medical school gives you a lot of experience with different ones. You have to have an inkling of what you think you like, but most of the time there's definitely some exposure at least to help you make that decision. Was it difficult to get into residency? I matched high on my match list. I had great USMLE scores, and I had uh, I did well on the interviews, and so I matched really high and got my first choice. There are medical students that don't match, and so I don't want to say it's easy or hard. It was worked out nicely for me, but it has to do, just like everything else in life, with how you do in med school, what your grades are, what your USMLEs are, what your letters of recommendation say, because your med school write a letter of recommendation for you with how you did in med school. So it's, I don't want to say it's easy, but it is definitely attainable because you know what you have to do, just like you kind of know what you have to do to get into medical school. There's a question down here that says, do you think it'd be useful to volunteer in high school? I think that any exposure you can have where you're around something medical is going to be good on your resume. I don't know what the volunteers at Cincinnati Children's do. I can't imagine that volunteering over anything is going to be bad for your college resume, and even more so for your medical school resume. So I think the next question with that is, what clubs and activities do you think would be useful to participate in? I think right now medical schools are very interested in well-rounded people. They want people who can do a lot of things. So, if your thing is, volunteering in a homeless shelter, then high fives for you. If your thing is volunteering at Cincinnati Children's, then great. I think it's more of, I'm well-rounded. I want to be involved in my community. I'm showing that I'm putting my time to good use, right? You're not sitting on your computer playing Brawl Stars or whatever else all the time. You're making good use of your time, and you have time management skills. And I think that's probably more important than the actual club that you're in. I mean, the same thing, you're going to show leadership skills if you join a speech club. Well, you're going to say, hey, what does that have to do with medicine? But if you're the president of that speech club and you organize a whole bunch of things for that speech club to do, then that's going to be beneficial. And it's going to show that you have those skills to manage time and to manage things. I don't think it matters as much the particulars of what club and activity you do. I was a volleyball player coming out of high school. And that's really what I did. I played volleyball. I worked. I had a job. I think there is usefulness to holding a job if that's something that you need to do. It shows responsibility, and you have to show up there at the right times every day. And so I think it's much more important that the clubs and activities that you do, that you fully vest in them, that you're all in, that you enjoy them, and that you're improving yourself as a person, versus, well, I was a member of the pre-med club, but you never went to any of the meetings and you never did anything with it. Oh, but I was a member. I think that doesn't do nearly as much as saying, hey, I was a member of the marching band and we had practice at 6 a.m. every day, and I showed up, and we did well, and then I was was first chair. I don't do band, sorry, but I was the captain of the volleyball team. I was the leader in the speech club. What can you do to be the best at what you do? I think is much more important than what you choose to do. I think you find clubs and activities that interest you, that you can fully invest in, and grow yourself as a person. Like I said, the medical schools now are looking more at well-rounded people versus, I studied, I set the curve in my calculus college class. I don't think that is as important now as it was 20 years ago when I was trying to get into medical school. So I think that you just have to decide that you're passionate about whatever skill it is, and that you do the best job you can do while you're doing that. Medical schools don't usually offer scholarships at all. There's all kinds of loans. You can, I mean, I'm sure there's some you can apply for that'll be a little bit, but realistically, you're going to pay for it, which in comparison, my medical school is very inexpensive compared to what people are paying now. But there's no way I could afford $30,000 a year when you don't have a job and you're going to school full time. So they have loan situations set up for you that you can borrow the money to be able to do that. But there's not really, at least at my medical school, there weren't scholarships the same way there are scholarships to college. What age do you have to be to volunteer? I'm sure that has to do more with where you're volunteering. Maybe you can help me more with that, Debbie. But, you know, I think that if you called Cincinnati Children's, you probably have to ask them what their volunteer limits are. I know we have a bunch of high schoolers in the summer last year at our high school, at our hospital, that were volunteering. And they weren't all 18, I know. So I think that it matters probably hospital to hospital or volunteer opportunity to volunteer opportunity. You know, you can go serve meals at a food bank and you don't have to be any age. So I think it's what your volunteer opportunity is. And once again, find something that you care about. You know, if you're volunteering at the food bank and the whole time you have a frowny face on and you're not enjoying it and everybody can tell, what good are you really doing? I mean, the whole point of all that volunteer experience is to show that you are a well-rounded person and that you care about your community and the people around you. So I think that finding that niche for yourself, and that goes back to the clubs, activities, volunteer, whatever it is, that you do something that you find it in your heart somewhere that it's important to you, whether it's because, you know, your cousin's sister's little kid had to go to Cincinnati Children's when he hit his head, or whether it's because, you know, whatever it is that inspires you. You got to find that part of it. And not only will then the volunteering mean more to you, but you'll get more out of it too. You'll be a better person for
it. So. That was a great answer.
Trying to convince my own kids of it. Can you tell?
No, that was wonderful. Actually, all of your answers and students, your questions were great today. That last one, that was something I had wanted to go back to that you said right at the beginning. You talked about med schools and how they are looking to see how you spend your spare time. And so, you know, that's something to think about, and how you spend your spare time can provide you with some of those experiences, such as volunteer. I love that you brought up they don't always have to be in a healthcare environment. Dr. Alten expressed that one of her greatest strengths and one of the things that she had to really work on was not really work on, but she had to make sure that she became really good at it, was personal relations. And so any kind of volunteer work that you take on usually will help you develop those personal relationships.
Absolutely.
And I think, you know, recently I had a group of students who had applied for a scholarship at a university. And unfortunately, we didn't have anyone receive that scholarship. This was last year. And I spoke to the dean of the college and asked for feedback, because typically we would have students, you know, several students receive sometimes full scholarships. And the dean of that college told me that for the first time, they had found students with the best resumes that they had seen. They had a list of volunteer activities, a bulleted list. But he said when they interviewed them, they could not speak passionately about anything on the list. And so I thought that was tremendous feedback for all of our students and for ourselves. You know, be sure to be able to talk about your takeaways from the experience. Sometimes the experience may affirm it's something you do not want to do, but hey, it's an experience, right? So, well, we really appreciate your time today. And wow, this was an awesome session. Thank you so much.
Good.
And students, if you have additional questions, feel free to send them to me, genteend@masonohioschools.com, and I will forward them to Dr. Alten. And we really appreciate you taking time on your day off.
It's my pleasure. I hope that y'all get a little bit of insight. I know that you obviously are trying to make life decisions, and that's super hard to do when you're young. But I think exactly what Miss Gentine said is experience a lot. Go out and find what you're passionate about. And I don't call my life a job. It's really truly a career. And I love to go to work 9 out of 10 days. And so that makes everything else in my life easier. And so that's really what you're looking for. What are you passionate about, and what will make you happy in the long term? Because, I'm going to be a doctor for 30 years before I retire. It's a long time to be miserable. So think about what you love, experience. I'll be happy to answer any questions if you want to email. I'm happy to, no problem. And thanks for listening. Those are great questions. I appreciate it.
Thank you. Everyone have a great day. And remember, those relationships matter.
All right. Bye-bye.
Bye.
I don't know how to get off. Meeting.